good day and welcome to the National Emergency Operations Center COVID-19 weekly briefing for January the 6th, 2021. We thank you for joining us for today's briefing. This is our first briefing for the new year, and we here at the NEOC take the opportunity to wish you a happy new year, and may you have good health, strength, and everything that your heart desires this year. We continue, of course, to bring you information with respect to the management of the COVID-19 pandemic here in St. Kitts and Nevis. Of course, as you are seeing all around us, St. Kitts and Nevis is doing much better than many countries around the world. Some of them have to go back to lockdowns and very strict lockdowns and so on. And we thank God that the COVID-19 pandemic has been managed very well here in St. Kitts and Nevis by the team and by everybody in society with the all of society approach. People basically following the protocols that have been put in place. Even though we have no community spread, people are still following the protocols, and that is good. We see in some places in the world where people are protesting and not following the protocols, even though the virus is rampant in their societies. So we are to be commended for being obedient. I would like to invite Dr. Cameron Wilkinson, who is our Medical Chief of Staff at the Joseph N. France General Hospital, to give us a presentation. Dr. Wilkinson.
Thank you very much, Leslie, and Happy New Year to everyone. The fight against COVID-19 is a fight for our survival. The severity of the impact of this disease on countries is measured by the strain it places on their health system and lives lost, and not on economic activity. The priority should therefore always be lives over livelihood. We continue to see an increase in the number of cases and deaths across the globe. In California, ambulance drivers are being asked not to bring persons who may not survive to hospitals, as there is an acute shortage of beds and oxygen. In that same state, one person is dying every 15 minutes from COVID-19. Around the Caribbean, we are seeing our neighbors experience a surge in cases and community spread. Here in St. Kitts, we have been more fortunate in the fight, with no major hospitalizations and no deaths thus far, and a limited number of imported cases. This has caused us to be recognized internationally as the country with the lowest rate of confirmed COVID-19 cases and having the lowest COVID-19 risk in the hemisphere. While we get some applause as a nation for a successful fight thus far, this is not the time to drop our guard and boast and become complacent. The nations of the world are all different ships in the same storm, fighting for survival. The protocols and procedures we put in place and you abiding by them are what have kept this ship asail thus far, but our fortunes can change overnight. This virus is highly infectious, and it takes only one undetected imported case to lead to community spread. We have also recently learned of a new variant that is even more infectious than the original virus, although as yet it has not been proven to be more deadly. This new variant has been found in the United Kingdom, the United States, and Canada, and may soon make its way around the globe and here in the Federation. 4 cases of the new variant have already been confirmed in Jamaica. The risk of it reaching here is very high. This is even more reason for us not to become complacent and maintain our strict protocols that have kept us safe thus far. There are now 3 effective vaccines available to help the global community end this crisis. I thank God that we have put ourselves in a position to be around to benefit from the vaccines. 1.8 million other persons were not so lucky and died globally from this vaccine, from this virus. Hopefully, we will, through the COVAX facility, receive our vaccine later this year. For now, we need to continue the fight, which brings me to testing. This is a very important leg in the fight against COVID-19. Thus far, we have been able to test everyone who needed to be tested with the gold standard PCR test and isolate those who were positive and quarantine contacts and suspected cases. We have been fortunate to have the capacity through New Generation Laboratory to do our testing locally with a turnaround time under 24 hours for results. With the increasing demand for testing and hundreds of samples to be processed, this short turnaround time is not always going to be possible. We receive complaints from visitors and returning nationals to our shores all the time about the difficulties in obtaining a COVID test within 72 hours as is required for entry into the Federation because of the long wait time in getting testing overseas. Yet, some persons complain when they are tested on day 14 of quarantine and their results are not back in under 4 hours. Our staff has been working non-stop around the clock for the last 9 months and are beginning to experience burnout. We need to protect them and keep them safe and healthy. Healthcare workers account for 3% of the world's population, but 14% of COVID-19 infections. Though we preach physical distancing as an essential tool in the fight against this deadly virus, we have person-to-person contact every working day with complete strangers. We are the profession at greatest risk. While we will continue to work tirelessly, it is becoming increasingly unrealistic to set a goal to deliver hundreds of results on the same day persons were tested, as our capacity is being stretched. Going forward, when you enter quarantine, you should expect to be there for a minimum of 14 days and possibly an added 24 to 48 hours pending results. Simply put, depending on the volume of persons to be tested, not everyone will receive their results back in under 24 hours, as the process may take as long as 48 hours. We apologize for the inconvenience this may cause to all persons going into quarantine, but we will continue to deliver the best service possible with the health of our nation as our primary focus. Let us not lose the gains we have made and continue to work together in this fight. The all-of-society approach has been the cornerstone of our success. We encourage each and every one of you to continue to assist in whatever way you can to help in this fight. It may mean telling a loved one that this is not the time to fly in and visit, or you delaying that visit overseas and having to return and go into quarantine. Each time someone enters the Federation from a hotspot, there is a risk of importation of the virus. And so we advise you not to do any unnecessary travel. Continue employing the non-pharmaceutical measures that have worked for us thus far: hand sanitizing, wearing a mask, avoiding crowds and close contact and close spaces, until we get the vaccine to help us get out of this crisis. Thank you.
Thank you very much, Dr. Wilkinson. I now invite Superintendent Cromwell Henry to speak to us with respect to the law.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all. Trust that we all had a very peaceful and fun-filled carnival. Today I speak to you on the new COVID-19 Prevention and Control Act and I will speak to one aspect of that act, and as the weeks go by, I will touch on other aspects of the act that we should be aware of. The COVID-19 Prevention and Control Act, number 16 of 2020, came into operation on January 1st, 2021. This act replaces the emergency powers regulations and retains all of the COVID-19 protocols that we are all so familiar with. In addition, the act introduces protocols for travelers entering the country via air or sea, protocols for the operation of hotels and other accommodations, public transportation, and mass gatherings. As the virus is transmitted through close person-to-person contact, social activities remain restricted. Section 9 of the Act restricts persons from attending, hosting, or visiting a social activity or gathering of more than 25 persons without the written permission of the Commissioner of Police in consultation with the Chief Medical Officer. A person who contravenes this particular provision, that is, attending, hosting, or visiting any social activity without written permission, as aforementioned, will be liable on summary conviction to a fine not exceeding $5,000. The Act also places a cap on the number of persons attending social activities or mass gatherings. It places events into 3 categories: small events with 25 to 50 persons, medium events with 51 to 100 persons, and large events with 101 to 150 persons. Note that the maximum cap on events is 150 persons. In processing applications, consideration will be given to whether or not the event is indoors or outdoors, with a more favorable look on events that are outdoors. Permission will not be given for any indoor large event of over 100 persons, as the risk of virus spread is greater in these situations. A minimum of 30 square feet for the venues of indoor events will be required for adequate social distancing. This will also be required for outdoor events. Event promoters, entertainers, and organizers are required to submit your application online via the website police.kn. Detailed protocols and guidance to event organizers are also available on this website under the Information tab. In closing, I wish to remind you of the basic and most effective way of avoiding being infected with the virus. Wear face masks when in public, sanitize your hands and frequently touched areas, avoid crowds or crowded places, and always maintain a physical distance of 3 to 6 feet from others when in public. Thank you.
Thank you, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center Situation Report. Dr. Laws.
Thank you, Mr. Williams, and pleasant good afternoon to everyone. And I want to use this opportunity to wish everyone who is joining us this afternoon a happy new year and a near normal 2021. So it's my task to share with you this afternoon the HEOC Situation Report for January the 6th. So last Saturday, the Ministry of Health would have disseminated a media release announcing the additional imported case of COVID-19. The traveler would have arrived in the Federation on December 27, and this brings our total number of COVID-19 confirmed cases to 33, 22 in St. Kitts and 11 in Nevis. At present, we only have 2 active cases, and so 31 cases would have fully recovered. The 2 active cases, they are in isolation and they are stable. We are monitoring them closely. Based on the World Health Organization's dashboard, COVID-19 dashboard, the total number of confirmed cases of COVID-19 globally stands at 84,780,171. The death toll globally stands at 1,853,525. Almost 25%, more specifically, I think 24.8% of the confirmed cases were reported by the United States of America, and almost 19% of the global deaths were reported by the United States of America. Within the Caribbean region, the total number of confirmed cases of COVID stands at 372,177, and the death toll stands at 5,914 as of January the 4th. What's happening in our neighboring islands? Now, Barbados is presently experiencing a surge in the number of COVID-19 cases. Barbados would have reported over 321 cases of COVID-19 within the last 14 days. Their total stands at 643. Grenada is also experiencing a surge in their cases. They would have reported 56 cases within the last fortnight, bringing their total to over 163. St. Vincent and the Grenadines, 26 cases within the last 14 days. The total number of cases, 133. St. Lucia also reported as many as 57 cases within the last 14 days, bringing the total there to approximately 360. A number of these islands, they are experiencing an increase in the number of cases associated with incoming passengers from hotspots, meaning travelers, tourists, and returning nationals. In St. Kitts and Nevis, we would have tested over 6,000 persons so far, and with a positivity rate of approximately 0.5%. At present, we have about 16 homes involved in home quarantine, secured by commissioner-prescribed security. We have, as I said before, 2 persons, 2 active cases in isolation, and the number of persons in quarantine facilities stands at about 249. Earlier this afternoon, 2 charters would have landed in St. Kitts, one from Miami and one from Puerto Rico, bringing the 6th batch of students for the Ross University School of Veterinary Medicine. The charter that arrived from Miami would have brought about 87 students, and we had 5 students coming back from Puerto Rico. So a total of 92 students would have been transferred from the RLB International Airport to the dorm on the RUSVM campus. The students would have had their samples, let me back up. Now, the students would have had their pre-arrival RT-PCR test done in Miami on Monday, and only those with negative results would have boarded the charter. And then upon reaching or arriving at the RUSVM campus this afternoon, their nasopharyngeal swabs would have been taken upon arrival. So their samples will be processed, and then they would be placed in quarantine in the dorm at RUSVM for 14 days, after which they would receive their exit RT-PCR test. Once negative, then the students will be free to attend classes and integrate into our society. Okay, so just a summary as to what's happening globally in terms of the COVID-19 status. If you follow what's happening in the news, you would have heard about a new variant strain of the SARS-CoV-2 virus found in South Africa and Nigeria, and a new variant strain spreading across most of England. The science seems to suggest that these three strains of the SARS-CoV-2 virus are different. And so the scientists seems to have done quite a bit of work on the new variant that's circulating in the United Kingdom. And what they are saying is that this new variant in the UK is highly more transmissible than the virus's previous version. And because of that, the UK is seeing and experiencing a surge in the number of cases. Just yesterday, January the 5th, the number of new daily confirmed cases in the United Kingdom topped 60,000 for the first time. And the BBC tells us that the number of patients in hospitals in the UK is 40 times higher than what they experienced during the first peak last year, 2020. And as a result of that, England is in its third national lockdown, coming into force, I think, yesterday, and this may extend until approximately mid-February of this year. Now, a little bit more about this new variant in the United Kingdom. As I said before, it's a little bit more transmissible. The science is, wavering between 56% to 70%. And so what this means is that this version of the virus spreads more easily between persons. How it spreads faster, it will infect more people, and because of that, the death toll will increase. However, the science seems to suggest that persons do not necessarily become more ill. However, one person who is infected has the potential of spreading it to an increased number of persons. Now, as a result of this, returning nationals to the Federation from the United Kingdom, we are asking them to be quarantined, confined to their rooms for the 2-week quarantine period, and then they will be they would have the requisite RT-PCR test done. Once negative, then they are free. They will be free to integrate into our society. So at present, if you are a returning national to the Federation from the United Kingdom, you won't be allowed to vacation in place. You would be quarantined, confined to your rooms for the 2-week period. Scientists have also discovered the new variant of the SARS-CoV-2 virus in Colorado and California in the United States. However, based on a report coming out of the New York Times today, this new variant at present seems to be somewhat rare. For now, in the United States of America, more testing is required in order to determine the extent and ultimately its prevalence in the U.S. All right, in terms of vaccines, the United Kingdom became the first country to approve the AstraZeneca's and Oxford University's COVID-19 vaccine for emergency use on December 30. And this vaccine, this third vaccine, was rolled out in the United Kingdom as of Monday, January the 4th. Now, unlike its competitors, this AstraZeneca Oxford COVID-19 vaccine can be stored at higher temperatures, meaning between 2 and 8 degrees centigrade, temperatures what we are accustomed to in terms of vaccine, of regular vaccine programs. And so the vaccine can be stored at these temperatures for as long as 6 months. And so this is good news for territories and member states like ours. It's cheaper also than the Pfizer, BioNTech, and Moderna version. It uses a different methodology in terms of, persons mounting an immune response. The regime, meaning the AstraZeneca Oxford vaccine regime, has an efficacy of 62%. Now, this regime involves 2 doses, so persons who are vaccinated with this vaccine, you're required to get 2 doses. 1 dose and the second dose can be given anywhere between 1 month to 3 months, up to 12 weeks. So your second dose can be had up to 12 weeks after you would have received the first dose. The UK has on hand as many as 530,000 doses of this new vaccine ready. And so the vaccination program in the UK is well on its way, and as many as 100 million doses on order. Now, AstraZeneca has promised several hundreds of millions of these of doses to low and middle income countries. And more importantly, the COVAX facility has a standing order with AstraZeneca and Oxford for as many as 170 million doses. And as you are well aware, St. Kitts and Nevis has signed on to this COVAX facility, which gives us an opportunity to access this third option, AstraZeneca. Within another week or 2, or within the next month, the Federation will be informed in terms of the vaccine candidates that will be made available to the Federation in the second quarter of this year. Now, based on all that we would have shared regarding this new variant and the fact that it spreads more easily, right? It's even more important for individuals like yourselves and for all of us. We need to and we must religiously adhere to the COVID-19 prevention measures of wearing the face mask, maintaining good and adequate hand hygiene, maintaining appropriate physical distance of a minimum of 3 to 6 feet between individuals when in public spaces, and ensuring that the environment where we are gathered for prolonged period of times, that there is appropriate and recommended ventilation. Because you and I, we are not sure if and when this new variant will arrive on our shores. Thank you.
Thank you, Dr. Laws. I now invite Mr. Abdias Samuel, who is the chair of the COVID-19 National Task Force and the National Disaster Coordinator at the National Emergency Management Agency, NEMA. Mr. Samuel.
Mr. Williams, thank you very much, and welcome to all our viewers and listeners. And I must begin this briefing by wishing you a very happy and jolly and prosperous 2021. And we do hope that we have a easier 2021. I would like to advise the general public that persons seeking to return to the Federation and need to quarantine at the Koi Resort. They are now open, and the Koi Resort is providing this service at a rate of $60 per night for regular rooms and $90 per night for suites. Please contact their reservation desk at 869-764-4499. The National COVID-19 Task Force, after taking a bit of a vacation, meaning from briefing and other things, however, we continue to work. We are very much concerned, of course, very much concerned about the number of breaches that have been taking place at quarantine sites and vacation and facilities where our tourists and guests are vacationing in place. In order to mitigate against these breaches, the COVID-19 Task Force, in collaboration with the Ministry of Health, have been engaged in these facilities in terms of having meetings, having these facilities calibrate their security measures, and also providing training on a regular basis, such as on a weekly basis, in order to enhance their level of compliance. The Compliance Task Force will be in full numbers enforcing the protocols, and in this regard, as the CMO would have said, we do not want to plunge St. Kitts and Nevis into no outbreak. Therefore, we are encouraging the general public to adhere to the COVID-19 protocols in wearing a mask, sanitization, social and physical distancing, as we have been doing in the past. The COVID-19 Task Force has already received the support to further increase the numbers of the Compliance Task Force. So shortly we will be recruiting a number of Compliance Task Force officers to add to the numbers that we already have. It is our endeavor not to have St. Kitts become one of those countries that has had to go into a lockdown. The National COVID-19 Task Force, in collaboration with its stakeholders, have engaged with the Park Hyatt and the Christopher Harbor in the filming of Below Deck reality TV show. This American reality television series is aired on Bravo TV that chronicles the life of crew members who work and reside aboard mega yachts. This show attracts over 1 million viewers for each episode, and the government of St. Kitts and Nevis has approved the filming of this show, which will commence in February 2021, and the filming will be for approximately 6 to 8 weeks. We are hoping that this activity will highlight our tourism product and advance the marketing and promotion of the Federation of St. Kitts and Nevis as a great and marquee destination for tourism. The CMO would have advised that the Ross University have repatriated a number of students today, and we are thankful that the Ross University continues to trust the work that is being done in St. Kitts and Nevis in keeping its citizens' residents safe. In that regard, there are 3 more projected operations of this nature. On the 27th of February 2021, the outlook is for 202 students to return to the Federation of St. Kitts and Nevis. On the 17th of February 2021, the outlook is for 168 students to return. On the 10th of March will be the last batch that should be returning with 145 students. So that's a total of 515 students for the Ross University that should be returning to the Federation in the first quarter of 2021. We want to commend the management, again, of the Ross University for their confidence. As we look around the world, we see a number of countries that have gone back into the lockdown of their state. We look at England, Scotland, Germany, who has gone into lockdown until the 31st of January 2021, the Netherlands, who has gone into lockdown until the 19th of January 2021, Austria has gone into lockdown until the 24th of January 2021, and closer we have the curfews that have been implemented in Barbados until the 14th of January 2021. With that said, we want to encourage our citizens to remain vigilant and report any breaches that you may see or observe anywhere in St. Kitts and Nevis. The government of St. Kitts and Nevis has further suspended the BA flight from the UK in light of the new corona strain, meaning the flights that would have that are scheduled for the 9th and the 16th of January 2021 will not be arriving in St. Kitts. I wish now to move to the activities with the La Soufrière volcano that is plaguing St. Vincent and the Grenadines. The government of St. Kitts and Nevis has already showed solidarity with the government of St. Vincent and the Grenadines, where the Honorable Prime Minister, Dr. Timothy Harris, as the Minister of National Security with responsibility for the National Emergency Management Agency, NEMA, has reached out to the leadership of St. Vincent and the Grenadines and pledged our support. This has been done with many other national emergency management agencies or organizations throughout the CEDEMA member states in CARICOM. Scientists are keeping a close watch on the volcanoes in the Eastern Caribbean that have been quiet for decades. La Béguin oozing out of La Soufrière volcano in St. Vincent and the Grenadines would have begun on the 29th of December. The UV Seismic Research Center out of the St. Augustine University in Trinidad and Tobago has sent a group of experts to monitor the activity there. The alert level in St. Vincent at this time is that of orange, meaning that an explosion can be imminent within the next 24 hours. The National Emergency Management Organization in St. Vincent, NEMO, continues to provide daily updates to the general public in St. Vincent and to its regional partners in the Caribbean. Regional and international conversations through CEDEMA are ongoing to establish the response mechanism that will be required to mobilize approximately 16,000 to 20,000 persons if there is an eruption at La Soufrière volcano. I am asking the general public, our citizens and residents here in St. Kitts and Nevis, to keep St. Vincent and the Grenadines in your prayer. The local weather forecast for St. Kitts and Nevis: the broad area of high pressure coupled with low moisture levels will continue to restrict showers activity across the island. Weather tonight is going to be mostly clear. Tomorrow, mostly sunny with a 10% chance of rain or a slight chance of showers. Sunrise tomorrow is 6:42 a.m. Sunset tomorrow will be 5:52 p.m. With that said, I want to thank you, and we welcome your questions.
Thank you very much, Mr. Samuel. That brings us to our question and answers, and we will move right into them. Dr. Wilkinson, can you explain in the simplest of terms what is meant by a new variant of the virus, and how concerned should we be about it reaching the Federation?
Yes, we've been speaking about a new variant all afternoon, and it's important for everyone to understand what we're in fact talking about. Now, when someone becomes infected with the virus will replicate or multiply. And the longer the virus is around and multiplying within a community, that virus can undergo some minor structural changes. And these changes or mutations are what are called variants. And so if you have a number of changes occurring in a virus that makes it somewhat different from the original virus that started out, that would be labeled as a variant. And we are not surprised that this has happened because the SARS-CoV-19 virus has been circulating for almost a year now. And when these variants occur, one of two things can occur. It can have an increased level of transmissibility, which we see happening with the variants that have occurred in the UK and in the US right now, or you can have an increase in severity of the disease caused by, thank God, the new variant has not proven to have any more severe disease. The good news also is that the variant has not been changed so much from the original virus to make the vaccines that are available ineffective. And so we know the science has told us that although we have these new variants occurring, the vaccines that are available are still effective against this. Now, how concerned we are? If it's in the US, if it's in Canada, if we have reported cases in Jamaica, it's only a matter of time before it comes here. But we want to continue doing what we're doing. And the same way, we're one of the few countries to keep the virus at bay for a significant period of time before it reached our shores. We're hoping that we can keep these variants out until we get the vaccine, as the CMO said, within the latter part of this year.
Thank you, Dr. Wilkinson. Our second question. If I get the vaccine and travel to St. Kitts, would I still need to be quarantined for 14 days? Dr. Laws.
Mr. Williams, that's a very good question, and I wish I could say no. However, the answer is yes. So if an individual in the United Kingdom received any of the 3 vaccines and traveled to St. Kitts, yes, they would have to be quarantined for 14 days. And I suppose the next question would be why? All right, so the manufacturers have said, meaning the manufacturers of the 3 front runners or the vaccine candidates that have been rolled out, they are saying that the vaccine prevents you from getting severe disease and it prevents death from COVID-19. However, so that's the assurance we have from being vaccinated with either of these 3 vaccines. However, if an individual is vaccinated, there's no guarantee that the individual will not contract the disease. And then there's no guarantee that if the individual contracts COVID-19, that they can't pass it on to others. And so it's because of these 2 gaps or non-assurances that individuals who are vaccinated would still have to be in quarantine for 14 days. We test, make sure the virus is not on board before they can integrate into our society.
Thank you, Dr. Laws. We keep things rolling. The third question, if I already had COVID-19 infection, do I still need to be vaccinated? Dr. Wilkins.
Okay, we know that if someone contracted COVID-19, the immunity that they have is not lifelong. As a matter of fact, most of the studies have shown that after 90 days, the immunity wanes. Therefore, everyone, whether or not you had COVID-19 or not, should be vaccinated. However, if you have an active infection, let's say, for example, we got the vaccine here in St. Kitts tomorrow, and there were persons who having an active infection, those persons should not be vaccinated until they have recovered from their infection. It is also thought that if you had an infection, you can wait as long as 90 days before you are vaccinated, since you would have a limited amount of protection. Basically, what we are saying then, if we got the vaccine tomorrow and we had 10 persons who recently recovered from the COVID-19 virus and the vaccines were limited, we would vaccinate first those persons who were not exposed and wait another 90 days before we vaccinate those persons who would have had some circulating antibodies from the natural infection. I hope that makes it clear.
Our fourth question, we have learned of a super spreader event in Barbados that has been causing community spread. Will we enforce the rules governing mass events so that we do not see large crowds at football stadiums, etc., again to avoid us suffering a similar fate? Dr. Superintendent Henry.
Thank you, Mr. Williams. Yes, as I mentioned, there are some provisions in the new COVID-19 Act with respect to events. And the whole purpose of that is to reduce the size or control the size of gatherings. The maximum number of persons that will be permitted at any gathering would be 150, and that would be for an outdoor event where there is adequate spacing to accommodate social and physical distancing. For indoor events, the maximum number of persons would be 100 persons. And of course, that will be dependent on the size of the venue. Once provided that there is a minimum of 30 square feet per person, then that venue would not be allowed to carry that number of persons. Events are categorized in three sizes: small, medium, and large, with the minimum being 25 and the maximum being 150.
Thank you, Superintendent. The fifth question, with 3 vaccines presently available, how soon do you think we will get the vaccine here in the Federation, and which one would you prefer? And will the Chief Medical Officer and the Medical Chief of Staff lead by example and take it to allay the fears of those who have doubts about the vaccine? Not only take it, will you take it on TV?
I believe honesty is the best policy, and I was one of the kids growing up who was not really afraid of getting vaccinated. I don't know about Dr. Laws. I know when I was going to school, there were always some kids, when the nurses came around, they'd be running and screaming. And I believe in the safety and the efficacy of the vaccine. And if the vaccine becomes available and I am considered on the priority list, I'll be happy to take it right here on this program, and so that we can demonstrate to the entire nation that the vaccine is safe and that it should be implemented widely so that we can get out of this crisis.
All right, so in the same vein of honesty, I am one that used to be afraid of injections. So which one would I prefer? Well, the Pfizer-BioNTech vaccine there seems to be an issue with individuals who experience aggressive allergic reactions like I do. So I won't be first in line for the Pfizer-BioNTech vaccine. Actually, I don't think it's advised that I take that one. So probably the Moderna or the AstraZeneca Oxford University vaccine. So I think one of the other questions is which one? All right, so again, as I said, the Federation has signed on to the COVAX facility, and at present, we are not absolutely sure which one of these vaccine candidates will be ultimately available to member states like St. Kitts and Nevis. Which one is the preferred? Okay, so the Pfizer-BioNTech vaccine has to be stored at negative 70, 80 degrees, so we would need, special refrigerators to store that vaccine. The Moderna vaccine has to be stored at negative 20, again, I think a special refrigerator. However, the AstraZeneca Oxford vaccine candidate can be stored at within any of our regular refrigerators that we do have in country. And so probably, that, option may be widely available to member states like ours, and it's also cheaper. All right, so when will it be available? We are told maybe as early as the second quarter of this year. So anywhere between April, May, June. That's the projected timeline. However, once we are told specifically a date, the general public will be informed.
Next question is directed to tourism. I don't know if you have the information, but do you know if tourism issued approved seals to rental car companies? Mr. Samuel.
Thank you, Mr. Williams. And we have stated it before. In this first phase of the opening, we will not be allowing inbound passengers, tourists, guests to drive themselves at this moment. They will have to be transported by the COVID-19 certified taxis. However, it is something that we are going to review in the second phase of our reopening of the borders. Yes, Mr. Williams, let me just clarify something as well, that after their 14 days when they have cleared quarantine and they have been approved to reintegrate into society, they can rent a rental.
Okay, and this is our final question, or we have two more questions. Final two. Can anyone shed light on the report of false HIV positive tests associated with a vaccine out of Australia? That has been making its rounds in the news. And secondly, would we have to pay for the vaccine?
I'll address the easy part and leave the tougher one for Dr. Laws to answer. So as it relates to the false positive HIV test, yes, there was a drug company in Australia that was working on a vaccine that was showing significant promise. The vaccine, however, used a part of the HIV protein to help to stabilize the vaccine, and there are some of the persons in the trial who developed antibodies to this part of the protein that was included in the vaccine, giving them a false positive HIV test. And because of this and the implications of this false positive test, this trial was abandoned. And that is one of the reasons why we put these vaccines through rigorous trials, etc., before they come on board. It's important for you to note, though, that these persons who tested positive, it was a false positive, which means that the vaccine did not give them HIV, but they were developing similar antibodies to somebody who has HIV infection. That's why it was called a false positive. And so we can rest assured that there are no vaccines to date that are being used in the general public that would give you this type of reaction. I leave the next part of the question about paying to Dr. Laws.
Dr. Wilkinson left the harder question for me. Based on my information, we would have paid the required down payment to the COVAX facility that would make available to us enough vaccine that would cover 20% of the population in the initial instance. And just this morning, the Republic of China, Taiwan, the embassy, the ambassador would have visited the Ministry of Health and informed us that the Republic of China, Taiwan, is making a very generous donation to the Federation of $600,000 towards the procurement of vaccine. And so based on what is already paid and the donation, I don't foresee, I'm not sure if a charge will be, we generally don't pay for vaccines, so I don't think there will be a charge in terms of persons being vaccinated. I don't foresee a charge. Yeah.
Thanks to all of you who posed your questions and all those who answered them. We have come to the end of our question and answer segment. I want to thank the people who have joined us today for our briefing and who continue to join us and paying attention with what is happening with the management of the COVID-19 pandemic here in the Federation. The pandemic is still with us, even though there are very hopeful signs of vaccines and so on. I thank Dr. Cameron Wilkinson for his presentation today, Superintendent Cromwell Henry, our Chief Medical Officer, Dr. Hazel Laws, Mr. Abdias Samuel, who is the chair of the COVID-19 National Task Force, director of the NEOC and NDC here at NEMA. I continue to thank ZIZ and all media houses in the Federation for continuing to partner with us, of course, with the broadcast, dissemination of information that is crucial in any sort of crisis management. We thank Ms. Vesta Southwell, who continues to be extremely useful, very helpful here at the NEOC. We also thank the Public Relations Officer for the Health Emergency Operations Center, Dr. Marissa Carty, all of the persons who continue to work in terms of, looking at the applications, for coming into St. Kitts, reviewing the information that is sent, all the data entry clerks, Ms. Ophelia Blanchard as well, who continues to offer great support, Mr. Nigel Farrell, and everybody. I don't think we can thank you enough for what you have been doing. Next Wednesday, we will be back with another NEOC COVID-19 weekly briefing. Until then, stay safe and continue to adhere to the protocols, the measures that have been put in place to protect our people. Take good care. I am Les Roy Williams.